licensed gynecologist and laparoscopic surgeon working in a private sector in Dubai. Today I thought I would like to discuss some facts and concerns about fertility issues in women. It is an important issue that is affecting about 10% of women population. What is infertility? The difficulty to conceive after 1 year of uninterrupted intercourse for 1 year is considered to be infertility. And it usually 80% of the women conceive after 1 year of intercourse, and 10 to 20% will have some difficulty in conceiving. So these are the women which face the problems of infertility. Usually it depends on the age of the woman. We have to start investigating and do tests for the fertility issues. If woman is of younger age, then we can give 1 year of 1 year time. Then only you start the investigations or the test to they evaluate the fertility status of the couple. If the woman and the partner is more than 35 years, then we will do the test little earlier. For example, after 6 months. So what are the fertility tests we do? And before that, I would like to tell what are the causes of infertility. 25 to 30% of the causes is because of the female factors, which can be because of polycystic ovaries, which can be because of the fibroids and the unhealthy lining of the womb, endometriosis, and the tubal factors. So the 25% is because of male factor. So another 25 to 30% can be unexplained for infertility or miscellaneous causes, mixed causes. So just I want to tell you about the general anatomy or the aspects of the female genital system. This is a uterus, and these are the ovaries, and this is the tube which connects the through which the egg and the sperm can pass. This is the fallopian tube, and this is usually the woman will produce egg every month. Like woman as such is blessed with 5 million of eggs at birth. When each year 10% of the egg will be reduced. There is no reason why the egg is reduced in per year. Then at 20 years there will be 2 lakhs. That is enough for the woman to get pregnant. There is some tests we do when the patient come with fertility. That is the very important is the detailed history taking of both the male and the female. That will really will help you to reach the cause for the infertility in some cases. Then the test we do are FSH and hormone tests like AMH. I want to tell many patients ask, what is AMH? AMH is anti-Mullerian hormone. This is usually produced by the small eggs, as I told you, you can see the ovary, each ovary is having small dots like this. They are called follicles or the immature egg. As I told you before, every woman, even before birth, there is a fixed number of eggs, that is 5 million. From each year after that, 10% decline of these eggs will be there. And so there is a fixed amount of the eggs. So these small eggs, they are called primordial follicles or the preandral follicles, which later develop into mature eggs. The AMH is the hormone which is produced by these small eggs up to 2 to 6 millimeter sized eggs. Usually a mature egg means it is like 18 to 20 millimeter. The AMH or the anti-Mullerian hormone is the chemical which is produced by these small tiny eggs. These will give an idea about the ovarian reserve of a female. So it can be tested at any time during the menstrual cycle. The usual value is around 1.5 to 8. If it is less than 1.5, it is low AMH, and if it is more than 8, it is called high AMH. Both are not good. High AMH is usually associated with the polycystic ovarian syndrome. So every time woman will come, they will ask what is the treatment for the low AMH. To be frank, there is no proven permanent solution, medical solution for low AMH, but some dietary changes, like you can take flax seeds, wheat germ, then vitamin D, DHEA, there is one medicine called DHEA. All these things can help to improve, but it is not permanent. And those who are having low AMH doesn't mean that they will not get pregnant or they will not have a normal healthy baby. They can have normal healthy baby, but maybe we need to give some medicines for making more eggs, like hormones, and then they can have normal babies. There is nothing to worry so much, but if it is very less, then we will have to go for the IVF or the artificial reproductive techniques. About the test, what we do usually for an infertile couple, when they come, as I told, we will take a detailed history. Then after that, the tests include some hormone test, including AMH, which I have already explained in detail to you. And then the other tests are FSH, or follicle stimulating hormone, and luteinizing hormone, LH. These hormones are usually measured on the second day of period, whereas the AMH, as I already mentioned, can be done any day of the cycle. Then coming to whether patient is ovulating or not, we do something called follicular tracking, or where we check the follicles by ultrasonography. Then coming to the tube patency test, where the tubes are patent or blocked, we need to check. There is some test where we inject dye from the front passage and we take special X-rays called hysterosalpingogram, or it can be done by injecting saline and checking by ultrasound, called saline sonography. And if there is any doubt about the patency by the above test, or if there is any history suggestive that the tubes are blocked, then we can do keyhole surgery also, and then dye test can be done, and it's called chromotubation, which can be done by laparoscopy or keyhole. Then coming to the other test, blood test, like usually what we do is a general test, like thyroid function is also very important, and we check the thyroid whether it's hyperactive or underactive thyroid. This can also affect the fertility of the woman. Then coming to the investigation of the male partner, mainly we do semen analysis. Usually semen analysis is tested after 3 days of abstinence. Then other important factor which I want to tell is that endometriosis. Endometriosis also affects the woman to get these issues of infertility. Those women who are having endometriosis, around 30% of women with endometriosis can have problems with fertility. When the woman comes with endometriosis, the medical treatment doesn't work, and it is mainly the surgical management, because endometriosis can also cause problems with the fertility aspect. It can affect the quality of egg, it can affect the quality of the embryo, it can produce a chemical which can be detrimental to the sperms, and it can cause adhesions or the sticking of the tissues, which can affect the tube factors as well. So these are the common things which endometriosis can affect as well, the fertility aspects of a woman. So when you are having any problem like this, we should not think that it is normal, and we should take medical advice when you have a difficulty in conceiving for quite some time, as I mentioned, 6 months to 1 year according to the age. As one more thing is that the infertility reduces with age, which everyone knows. So all these things has to be kept in mind, and you have to take medical assistance when it is required.